We are living in a time where globalization is becoming more and more evident. It's been some time since countries have been dreaming of a unified and developed globe, and steps have been taken towards this direction. The Millennium Development Goals is one of the bigger steps. Millennium Development Goals were proposed to narrow the gap between developed countries and developing ones. Of the Millennium Goals to be met, health is given more weight, as major players like the World Health Organization and the World Federation of Public Health Association have pinpointed, without progress in health, other Millennium Goals will also remain beyond reach. And if the health targets set in the Millennium are to be achieved, addressing the social determinants of health is essential. Though the role of key social determinants of health, like education, income, and social class, to name a few, were recognized decades back, very little has come out of the knowledge. A report published in 2008 by the World Health Organization Commission on Social Determinants of Health clearly puts that dramatic inequities in health and health services exist worldwide and affect individuals in places they live. Countries and international organizations have been trying to decrease the existing health inequities and the causes of the many concerned bodies. The World Federation of Public Health Association is one. Established in 1967, the World Federation of Public Health Association is the only worldwide professional society presenting and servicing the broad field of public health. Its mission is to promote and protect global public health by supporting health associates and societies of public health through the exchange of information, knowledge, and the transfer of skill and resources. On the 42nd Annual General Meeting held on the 18th of May 2008, the association selected Ethiopian Public Health Association to organize the 13th World Congress on Public Health to be held in Addis Ababa. The Congress started yesterday under the main theme, Moving Towards Global Health and Equity, Opportunities and Threats. The Congress will be concluded on the 27th of April, 2012. Ethiopian Public Health Association is a multidisciplinary association established in August 1989 with a vision to attain the highest possible standard of health for all Ethiopians.
The Ethiopian Public Health Association is one of the giant associations or professional associations in the country. It was established some 20 years ago in 1989. Now it has a membership over 4,000 ever registered, but active members are around 3,500. It has membership from all categories and professional disciplines, medical doctors, health officers, nurses, and advanced professional in health management, epidemiology, environmental health, what have you. So it has a diverse discipline and members from all corners of education and background. The association, since its establishment, has done quite a lot.
Moving towards global health equity, opportunities and threats are the themes for this year's World Congress on Public Health. Often, the term health inequities is used as a synonym for health inequities. However, it is important to recognize that, strictly speaking, these terms are not synonymous.
Health equity is, I think it's kind of like a philosophical approach to health. It has aspect of justice in it, so that every individual have the opportunity to have access to health services. Every individual has the opportunity to contribute to health services, to participate in decision making for health services, So it is involving the various players so that every individual has the opportunity and the right to access health services.
When you talk about health equity, the whole issue of like everyone has the opportunity to attain their full health potential, and no one should be disadvantaged from achieving their potential because of social positions or any other socially determined circumstances. When we say about social positions, it may be your socioeconomic status. If you are poor or rich or a middle class one, you shouldn't have a difference in terms of your health status. That's what we talk about health equity in terms of social positions. You can take race or ethnic groups, you can take gender. I mean, by becoming male or female, there should not be difference in terms of the health status. If there is a difference in terms of health status between a male and a female, then it's a clear health inequity rather than becoming an equity issue.
I think that it is important for me to refer to two important principles from the World Health Organization's constitution. The first thing is that it is important that everyone is enjoying the highest standard of health, and this without any distinction of race, of religion, of your political stand or social and economic condition, and looking at health as a fundamental right. The second principle is that it is also fundamental that health is looked at as a way to attain peace and security. Looking at those two principles that are well aligned with the United Nations Charter, one can see that health equity is a shared responsibility, and it requires the engagement of all.
The agenda of health equity is a global agenda, and it is a matter of, it has become a matter of increasing concern worldwide, we can say. Why? Because the world we live is a very complex and complicated world. We have no one system in the world. We have no one leadership. There is no one leadership. There is no one ideology or culture or socio-economic type of development. So there is disparity. We know there are rich countries, there are poor countries. We know there are civilized society or civilized countries, uncivilized countries, backward countries, poor, rich, and so forth. So because of this disparity and differences globally, the health equity issue has become a matter of global concern, because there is no equity as such. There is no equity. And whether you live in developed or even civilized world, there is no health equity. There is differences between minority and majority. There is differences between races. There is differences between ethnicity, educated and uneducated, and so forth.
Some problem which is now emerging, like cancer. How many doctors do we have in this country providing cancer-related diagnosis and treatment compared to the number of cases which needs that? We can compare this to another country, and then you can see there is a health equity problem between Ethiopia and another country because of the number of people to provide those services. So it all depends on which indicator you want to take. But there can be several indicators which can be used for looking at whether there is a health inequity or not. For most public health professionals, the best way is like looking at to the magnitude of disease, the magnitude of deaths, and some of the basic health services coverage is an important indicators.
When you are talking about inequalities, then you know that, for instance, Ethiopia has 80 million people. Out of the 80 million people, what proportion of this population are not accessing quality health services? That tells you whether this has been equitable distribution, equitable access, equitable utilization of health services has been achieved or not. It's not easy to achieve equity for all population at all times right now, but one needs to take this as a principle, needs to take this as a philosophy of the health services delivery system that would take into consideration those that have the likelihood of being marginalized and deprived to come into the centerfold, so that they are also taken as important.
Inequity in health can arise due to many different factors. In this respect, a number of social determinants contributing to health inequities have been identified.
Whenever there is a difference in your social positions, that's already some where that social inequity starts. The very good example is most of our hospitals are in urban areas. Even though you have the money, somebody living in the remote rural area may not have an equal access to the urban hospital compared to a person living in the urban area very near to that hospital. You need to pay for, when you talk about access, it's distance. Access, economical access can be there. Access because of the different cultural or quality of the services which is there in that institution. So that difference will start because you are living in a different places and the services which are available for you are different. Other social policy, when you talk about education, if you are most socioeconomic indicators like education, employment, housing, all those things contributes a lot for health inequity to happen there. As I have already explained earlier, the social determinants such as nutrition, the housing, some of the cultural barriers or traditional beliefs which may exist there.
It is evident that inequity in health exists among countries and within a country. What are the major steps countries should take to tackle the problem?
It is important for all the countries to create enabling environment, which means to take the right policy decisions, to ensuring that there are plans in place to be implemented, like the safety net programs. If you look at the situation in Ethiopia, if you look at the situation in Brazil, where they are doing a cash conditional transfer, for which they were able to take out more than 40 million inhabitants from poverty. It's also related to ensuring that money is no longer a barrier to accessing health services. It's also about protecting the most vulnerable populations, like women, like children. And it is also about putting in place a monitoring and evaluation framework.
Education level, poverty, displacement, war, geographical location and the climate. All these are confounding factors affecting health equity. So in order to have equity of health, the solution is, number one, we are now, most of the time we get sources and support from overseas, from outside the countries. And if we cannot just live on our own, and if we cannot economically make strong ourselves, we cannot always depend by the funds that we get from elsewhere to implement different programs. So economy is very important, and our economic development is the answer.
As the theme of this year's Congress indicates, there are threats as there are opportunities in moving towards global health equity.
Like, for instance, we have pharmaceutical companies producing drugs. In other places, we don't have drugs. We have all kinds of food material produced, and we know that some of those food materials that are produced may not be that healthy. So there has to be a regulatory mechanism globally. There is war, there is deprivation of resources, depletion of resources in many countries. Education is not equitably reached by everyone. The situation of women in some countries is deplorable. There are these things, but we know that we have enough experience and evidence worldwide that we can learn from one another to be able to move in that direction.
Looking at the situation currently is that the developing countries are faced with double burden of diseases. We've been having the highest burden of communicable diseases that have been with us for centuries. But now what we are seeing is an increasing number of non-communicable diseases, which make really life very difficult for decision makers in the developing country.
The opportunity is like we can share a lot of things from several other countries. At the same time, considering that the Millennium Development Goals and initiatives are a global initiatives, discussing this before some 3 years to finish this global targets is an opportunity to think for the future. As I've already said, this is not a short-term agenda, it's a long-term agenda to bring health equity in the globe. So it will be a great opportunity to bring new ideas, to see how things can go in the future in order to bring about better health equity.
Is it the right time to talk about global health equity? Can it be realized in the near future?
It's a right moment, and it is achievable goal. That achievability, measured by the direction that each country has set itself to achieve that equitable distribution and the resource allocation and the entire planning and overall direction of the services, both at a country level as well as regionally and globally. I feel that we are in the right track, but that does not mean that everybody is in the right mindset. So there is a lot of advocacy, communication, education, and such kind of consultative dialogue taking place to look at what critical factors are there to be addressed. What are those doable things that need to be done now to add on to the results that we would like to see in the future.
And a lot of countries are doing a lot in this front, showing that it is possible, but it will take political commitments, because social health insurance, you can't do it in a smaller community. It has to be nationwide. Then it's a need commitment at country level. But as you were asking rightly, it's a need a great commitment from the global level, because as you can see, many countries are among the poorest. Then I think that the global commitment and contribution toward that is a must.
Ethiopian Public Health Association has taken the responsibility in organizing the World Congress on Public Health to be held in Addis Ababa.
We have done a lot, and we have successfully done what we are expected to do in the promotion areas. We have very well promoted the Congress, and many people have submitted abstracts. About 726 abstracts have been submitted. This is the result of the first aspect of the promotion. Secondly, we have been promoting for fundraising. We have got also a number of partners and donors to support us, and we have almost met the requirements, the financial requirements that have been required for for the organization of the Congress. Now we have been doing also the promotion for individuals participate to come to Addis Ababa, and now we have also achieved a lot in that area. So far we have registered about 550 international participants, over 1,200 national participants. So that's a big achievement for us.
The 13th World Congress is a very good opportunity, specifically for my public health colleagues in Ethiopia and across the world. That's a time where we can discuss a lot of things, and coming to this Congress and sharing their experience, hearing experience of others will be an important opportunity. And the only message I want to pass is don't miss it. This is an event which is happening for the second time in Africa after long years, probably the first time after the millennium. And it's a big opportunity to get your colleagues across the world and discuss a lot of issues. And it's a very good opportunity also for Ethiopia for hosting this important Congress. We can learn a lot of things.
Well, there are a number of benefits, I can say, that Ethiopia can, and the Ethiopian Public Health Association could benefit. One, it's sharing experience. So we'll be, international people will be sharing their experiences, and we'll be also sharing our experiences. And secondly, we'll try to expose our achievements, challenges, and the best practices that have been gained in Ethiopia. And secondly, it gives an opportunity for EPHA to have partners among donors, among public health associations, and among other people, institutions and people. And the third is this Congress provides an opportunity for so many Ethiopians to participate, because though so many people may not have the chance of going out and participate in such Congress, but here, one, the registration is, when compared to the internationals, is 200 birr, and I think this is affordable. We try to really negotiate with the World Federation of Public Health Association to make the registration fee for Ethiopia to get it so low. So I think, and secondly, we are trying to have as many students to participate in this, and we are giving scholarship for students of public health and medicine. So about 200 Ethiopian students will benefit from the scholarship.
This event is so important that the world will give it undivided attention. Equity in health, as in any sector, should not be compromised.